I talked about MRD testing and its application to AML patients during their treatment and after treatment, so how we can assess the response of these patients. There are recommendations out now from the NCCN and also from the European Leukemia Network. They both recommend a certain sequence how we look at MRD. And first of all, we should look at molecular aberrations like NPM1 and fusion oncogenes, and then apply quantitative real-time PCR for MRD assessment. And if none of these aberrations is present, we should use multicolor flow cytometry if there's a leukemia-associated immunophenotype that we can look at. And then MRD patients should be controlled for and assessed for MRD at diagnosis after 2 cycles of chemotherapy and at the end of chemotherapy. And if you use a molecular technology, also during follow-up. And then the question is, what do we do if the patient is MRD positive? The guidelines currently are quite conservative because there's mostly retrospective data. However, it's now recommended that in patients with NPM1 and fusion oncogenes, you should act only at the end or during the end of treatment or during follow-up. However, there's data now, as I said, mostly retrospective, that give us an idea of the future, how we can improve and make best use of the technology. And on the one hand, that is data for patients in the favorable risk ELN category who usually receive chemotherapy. And if patients are MRD positive, then it has been shown that they benefit from allogeneic transplantation. Patients in the intermediate risk group, if they are MRD negative, they potentially don't need allogeneic transplantation, but do well with chemotherapy. So that could be another future application. And patients who anyway have to undergo allogeneic transplantation, there is a study that shows that haploidentical transplantation, so an increase of the alloreactivity, can overcome the negative prognostic effect. So these are predictive factors and ways to deal with the negative prognostic impact of AML. And I think that will be the future, how we make best use of MRD.